This is apropos. Cuts to foreign aid, particularly by the United States, are disrupting efforts to vaccinate children against deadly diseases almost as much as the COVID-19 pandemic did. That stark warning coming from the United Nations today. The WHO also adding to the chorus of alarm. It says emergency and routine vaccinations have been significantly impacted in dozens of countries since the start of April as a result of the slashes to global aid. Well, it comes as outbreaks of infectious diseases are on the rise globally. Gostin has this report.
It's a stark warning from three major health agencies. In a joint statement, the World Health Organization, UNICEF and the Global Alliance for Vaccines and Immunization say outbreaks of vaccine-preventable diseases are on the rise.
Vaccines have saved more than 150 million lives over the past 5 decades. Funding cuts to global health have put these hard-won gains in jeopardy.
The report highlights a sharp increase in both meningitis and yellow fever cases, with yellow fever spiking across Africa last year after a decade of decline. But what's raising the biggest red flag for health officials is measles. The disease is making a dangerous comeback, with global cases surging 20% in just 1 year. In 2024, cases were reported in 138 countries, with 61 experiencing large outbreaks, the highest number since 2019. The health agencies point to a mix of vaccine misinformation and severe funding cuts.
The global funding crisis is severely limiting our ability to vaccinate more than 15 million vulnerable children in fragile and conflict-affected countries against measles.
This year, U.S. President Donald Trump slashed humanitarian aid to several key regions. The organizations are urging him and other world leaders to ramp up investments in immunization programs. The statement comes as World Immunization Week kicks off, running April 24th through the 30th.
Well, let's speak to Lawrence Gostin. He's a distinguished professor at Georgetown University and the director of the WHO Center on Global Health Law. Lawrence, thank you so much for joining us on the program. It's really good to have you. To say that these cuts are causing a similar scale of disruption to vaccinating children against deadly diseases as the pandemic did is huge, isn't it? Because experts say COVID-19 caused the biggest drop in childhood vaccinations in a generation. Just lay out for us the implications of comparing the current situation to what we saw during the pandemic.
Well, we can easily compare it because it's not getting better and it may even be getting worse. And the stakes are huge. We found polio in Gaza, and we're unable to provide the vaccines needed to stem that and other outbreaks. There are childhood immunizations which are fully preventable through vaccines, such as measles, mumps, rubella. There are adult vaccinations, yellow fever. So people will die, many people will die, and many people will be sick and hospitalized, and all because of both cuts in funding and a fierce misinformation campaign about vaccines. And that misinformation campaign is not just among social media outlets, as we know, but it's also coming from the highest levels of government. For example, Secretary Kennedy, the health minister in the United States, is a known vaccine skeptic, and he's continued to pour cold water on the idea that vaccines are highly safe and effective, which they are.
Well, let's stay with the United States because many of these cuts are being done to align health initiatives in the US and also globally with Trump's America First agenda. Isn't it in America's interest, though, to keep diseases at bay in other countries so that they don't come to the US's borders? Isn't that also part of America First?
Of course it is. Frankly, we've seen the Trump administration on the very first day in office on January 20th withdrawing from the World Health Organization, and also uh, uh, stopping immediately all funding of the World Health Organization. Since that time, cuts to UNICEF, to the Gavi Alliance, which procures vaccines that are affordable around the world, have also been cut. And as I say, the administration has undermined vaccines through a mis and disinformation campaign. All of these things are deeply concerning. And yes, absolutely, the United States can't stop the onslaught of vaccine preventable diseases like measles unless children around the world and adults are vaccinated, and also that Americans are vaccinated, neither of which is happening. For me, this is a perfect storm, as I've written in a journal recently, for the spread of infectious diseases. And particularly, we have a major 15-state measles outbreak in the United States, threatening measles elimination in the United States. And also, we have an avian influenza outbreak. And so when we try to vaccinate for influenza, we may also find ourselves on the short end of the stick. This in no way advances American interest. It is in no way America first. It's America alone.
Stark words from you there. Let's go back to the Global Vaccine Alliance, Gavi, because the US has recently just filled a seat that was vacant on that board, the US seat. Tell us about the implications of that. What kind of effect are we going to see from that?
Well, I mean, I think we're seeing funding shortfalls for Gavi, and that's really concerning because I can't think of a global institution that can save more lives than the Gavi Alliance by procuring affordable vaccines for low and middle income countries, the most disadvantaged, the most marginalized, the most rural populations. Having a US seat will mean that President Trump appoints that seat. And just like he's done in the United States advisory committees, he's appointed scientists or so-called scientists to CDC, FDA, and NIH advisory committees that are suspicious of vaccines. And this is happening globally as well, including the board of the Gavi Alliance.
Well, the Trump administration has characterized its policies as measures to eliminate waste. The US is believed to spend around $1.5 billion each year on a global health security. And experts say that there's an estimated, I'm just going to read this to get this right, $54 return on US investments for every dollar it spends on vaccines. I mean, surely that isn't waste.
No, of course not. In fact, the amount we spend on global health and international development assistance for health is just a rounding error in the US budget. President Trump likes to think that we're hard done by, that we give more money than any place else in the world. But yes, we do give more money, but on a per capita basis, we don't actually compare favorably to many of our Western peers. And of course, funding for global health and foreign assistance brings enormous influence and leadership for the United States. It serves our national interests and is highly cost effective, as you say. It brings in more cost savings in the United States than we outlay. Remember, just a measles outbreak, or even worse, a public health emergency, can cost tens of millions, if not billions of dollars in unnecessary costs for medical care and hospitalizations. We can prevent diseases, and why wouldn't you want to prevent a disease rather than spending a fortune on responding to it?
And that's the question on everybody's lips. Can the rest of the world make up for these shortfalls as the US starts to withdraw more and more from the world stage when it comes to health? Do you see other countries being able to step up?
Other countries can step up, but they haven't stepped up, and they won't step up. And I think that's a shame. You see in Europe, for example, France, Germany, and the United Kingdom cutting back on foreign assistance, in many cases to increase their defense spending in relation to Ukraine. We could do better than that as a community. It costs very little to prevent and mitigate public health emergencies of international concern, but it costs a fortune when we're in a pandemic or a public health emergency. We really can do better. This is short-sighted. The world can do better. The United States can do better. And it's time for all of us to kind of come together as a global community and care about each other. And we should care about the climate. We should care about Mother Earth. And we should fight together against novel viruses that are always threatening us and always have historically.
Yeah, hopefully the world listens to that message. Lawrence, thank you so much for joining us on the program. It was really good to talk to you today and get your analysis on what is a very important issue. Stay with
Thank you
us
for having me.
here on World Roundup. We're going to